This season is the first year since the start of the pandemic way back in 2020 for some to resume their holiday gatherings like they used to, like the old days. Health officials are still urging caution. Joining us right now, Dr. Paul Burton, Chief Medical Officer at Moderna. Thank you so much for being with us. Of course, we have to ask you a question about some new data that's come out, similar to Pfizer-BioNTech. There's a study that suggests that 2 doses of the Moderna vaccine might not be effective enough against the Omicron variant, and the Moderna booster is necessary. Is that true?
Adrian, good morning. Look, I think that probably is true. What we know about Omicron is that it has numerous mutations, many of them in the spike protein, which is the bit of the virus that the vaccines go after. So it's not surprising that the vaccines don't act against Omicron quite as effectively as they do against Delta or the original strain. But as you say, what we're seeing is that if you give the booster shot of these vaccines, of the Moderna vaccine, you increase the levels of antibody, and that will likely give you some protection.
I do also want to get some clarity over some comments that Dr. Fauci has mentioned this week, saying we don't need a specific Omicron booster. But isn't there talk about Moderna developing a specific Omicron booster shot as early as this coming year, 2022?
Yeah, so look, I think, Dr. Fauci's comments are correct. What we have right now are the vaccines that we have, and they're highly effective. The Moderna vaccine has been shown time and time again to really provide excellent protection, as they all do. So I think what we have to do now is, if people are on the fence, get vaccinated. If they are thinking about getting boosted, there has never been a better time to get boosted. And there's actually a great website, makeityourvaccine.com, where you can get some good information. But Adrian, we're leaders in this field at Moderna. We're leaders in mRNA technology and in vaccines, certainly against COVID. And so it's on us. We don't know what the position with Omicron is going to be next year, but we have to be prepared if indeed it is the predominant strain in this country and around the world. So we're making that vaccine at risk, and we'll continue to do that.
Well, let's talk about Omicron, because here at Morning in America, NewsNation, we're really endeavoring to share all the perspectives of our audience. We have different schools of thought that we hear amongst friends and family members and on news networks. There's different thoughts about Omicron, whether it is indeed as dangerous as other strains of the virus. You have other people who are thinking there's a lot of overreaction to this particular strain because it's so new, but yet so different. Milder symptoms are being shown to be displayed among those who have contracted Omicron. And then you have a school of thought that feels that this could be very scary because we don't know anything, and they don't want to downplay the seriousness that this could show in coming months. What is the science that you know now at Moderna about Omicron?
Yes, so Adrian, you're right. We first heard about Omicron, on Thanksgiving Day, I guess, and we didn't know much then. I think we do know more now. I'd say the first thing is that this is highly transmissible. There were maybe 200 cases a day in South Africa at that time. In these past days and weeks, we've seen cases per day go up to 25,000. In the UK yesterday, they had 88,000 cases. Many of them will be Omicron. So it's highly, highly transmissible. People who get infected with the Delta strain of COVID typically do not get reinfected. But what we're seeing with Omicron is information that those people can absolutely get reinfected. So Omicron doesn't respect prior infection. That's an important fact as well. And then regarding severity, look, I think you're right. We're not seeing the cases of death, thankfully, that we have seen in earlier parts of this pandemic. But data from Denmark in just the last few days says that the hospitalization rate there for Delta is about 0.7%. What they're seeing with Omicron is about 0.8%. So it's certainly in the same range as we see with Delta. So it's a highly transmissible variant that is able to reinfect people, and with a similar hospitalization rate to that seen with Delta. So I think we don't need to panic, but we do need to take this very seriously.
Yeah, I like that you have given so much information. We haven't necessarily heard the reinfection rates, which we're happy to hear here. Also, a lot of people are concerned about getting the influenza shot, the flu shot, in combination with the booster and their dosage. I mean, some people are getting 5 shots at one time. What is your stance on that?
Yes, so in actual fact, we have done a study, and it's available online, where we've looked at co-administration of the COVID vaccine with a flu shot. And the effectiveness is exactly as you would predict. There are no increased adverse events or bad symptoms. So absolutely, go ahead and get the two together.
All right. Thank you so much, Dr. Paul Burton, Chief Medical Officer at Moderna. We appreciate your time, and thank you for putting it in a global perspective as well. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.